I'm Dr. Ben.
I'm Dr. Shane. Thanks for letting us care for you here at Heritage Oak Dental. You just left the office and you had a root canal. So we want to talk about how can we manage the pain? How are we going to deal with the diet? And how can we take care of the site with our hygiene?
So after a root canal is completed, oftentimes you're going to have mild to moderate discomfort. And a lot of times that's because of the infection you had coming in. And so what we're going to recommend in this case is what we put in your post-op instructions. Follow those to a T. One of the things I like to do is talk about alternating ibuprofen and Tylenol. And so that every 3 hours you're alternating. For the specifics on it, look at your post-op instructions.
And in terms of caring for the site with our diet, we're going to want to really lay off the tooth. The tooth is on a holiday for a little while. It's had some swelling in the bone, at the bone level. It's had swelling inside of the tooth, and it's had a surgery on the outside of the tooth. So we're going to really just leave it alone for a while and let that area heal. Softer foods are a good idea, and we got to care for the temporary crown. The temporary crown is temporary material, and it's got temporary cement. So when we floss, we have to go in the contact and out the side so we don't pop it off. In the case of a root canal tooth, we also want to just really avoid chewing on that area to allow it to heal.
That's basically it. Any questions about it, look at your post-op instructions. If that doesn't quite answer it for you, give the office a call and our team would love to take care of you. Thank you.